off with our first speaker. Our first speaker is Dr. Supratik Bhattacharya, and he's going to speak on the diabetes and the gut microbiota. He's a director of SCAN Diabetes and Endocrine Center. He has been awarded for a best diabetic awareness activities, and also he was a part of multiple phase 3, phase 4 studies, including the global DMARD studies. And he has been a speaker at various national and international conferences. And all of we learned that the origin of disease, whether it is a cardiac disease or a metabolic disease, now we believe that gut is the culprit organ. So we have a wonderful speaker, Dr. Supratik, to elaborate on such a nice topic in such a august audience. Over to you, Dr. Supratik.
Thank you, Chairperson sir, for your kind words of introduction. Thank you, Dr. Bansi Sabu and the entire team DiaCareCon 2020 for this invitation. It's a pleasure listening to all my previous speakers, and I'll just take 1 minute to share my screen. And hopefully it's visible to you now, and I'll just put it on full screen mode. So, great. Thank you so much once again for this kind invitation, and this is my topic for today. I'm going to talk about the diabetes and the gut microbiota. And so we all know about this very interesting story. So the brain, the heart, and the liver were having a conversation between themselves as to who was the most important, and then the gut was there as well. So the gut kind of said, well, why not me? And then the brain, the heart, and the liver started laughing at the gut. So this made the gut very, very annoyed, and he decided to shut down for some time. And we all know what happened a little later. So after this, I think unanimously, all the organs of the body finally agreed that gut was probably the most important part of the body. And if we go back all the way to Hippocrates, we know that he had actually mentioned that all diseases begins in the gut, and the health is determined by the microbiota in the gut itself. And 70% of our immune system is located in our gut itself. So if you consider the human being, who are composed of about 40 trillion cells, and you look at the gut now, there are about 100 trillion microbial cells, which we call the microbiota, and about 10 million microbial genes, which we call the metagenome. And if you look at the average weight of the microbiota, it's about 1.5 kilos. And they go through evolution, changing from infancy into the adulthood. And if you consider the microbiota, 95% is constituting of Pharmaceutical, Bacteroidetes, and Actinobacteria. And this is the classic development of microbiota. So if you consider in utero, the GI is completely sterile. And at birth, whether the person is having a C-section or a vaginal delivery, you acquire certain bacteria. For example, in C-section, you'd be acquiring Staphylococcus, Corynebacterium, Propionibacterium, for example. On the other hand, if a person is having vaginal delivery, then you'd acquire Lactobacillus, Prevotella, or Schnitzia. And then this keeps on evolving. So Enterobacteria, Bifidobacteria, Bacteroids, Bacteroidetes, and Firmicutes as soon as solid food is introduced into the system, and they kind of help in the carbohydrate utilization, etc. When you come to the adulthood, depending on the pathological condition, for example, if a person is obese, then we see certain changes in this microbiota. For example, in obese individuals, the Bacteroidetes decreases and the Firmicutes increases. Similarly, there are changes for Crohn's, allergy, or if a person is having a course of antibiotics, we see that the bacteroids actually go down. So just a short story about the Bacteroidetes, because it's one of the very important microbiota, and they're gram-negative, non-spore forming. They could be aerobic or anaerobic and rod-shaped in nature, and they're abundant in the guts as well as the skin. Now, you can see that I have highlighted Bacteroidetes in red, and bacteroids in green to differentiate between the two. You see that bacteroids are opportunistic pathogens, they can be, and Bacteroidetes, on the other hand, are symbiotic in nature. So bacteroids are highly abundant in intestines, and they take part in degradation of the proteins or complex sugar polymers. Bacteroid species are selectively recognized by the immune system, and Bacteroidetes, on the other hand, colonize the GI in the infants as non-digestible oligosaccharides in mother's milk support the growth of bacteroids and bifidobacterium, again, another very important microbiota. So in GI, microbiota or Bacteroidetes have got a very broad metabolic potential, and they're regarded as the most stable part of the GI microflora. And there's a reduced abundance of Bacteroidetes in obese individuals. They're also sort of involved in the pathophysiology of irritable bowel syndrome, type 1 and type 2 diabetes. And if you consider the bacteroid species, they are sort of found enriched in the metagenomes of the subjects with low gene richness and were associated with adiposity, insulin resistance, dyslipidemia, etc. Other ones that are very important we talked about, one was Firmicutes and Lactobacillus. So lactobacilli administered in combination with other probiotics are beneficial in irritable bowel syndrome and a host of other things. So just a difference between what is probiotic and a prebiotic. So probiotics are products which are aimed at delivering living, potentially beneficial bacterial cells to the gut ecosystem. On the other hand, prebiotics are indigestible carbohydrates which are delivered in food to large bowel to provide fermentable substrates to the selected bacteria. Now, if you see in health, there's absolute homeostasis, and the density, diversity, and activity of gut bacteria is maintained, whereas in dysbiosis, there could be diseases. Now, there can be external influences in terms of diet, so prebiotics, probiotics, etc., restore the balance. On the other hand, antibiotic usage or illness or lifestyle changes can cause dysbiosis. And also the internal host properties like the age, genetics, stress, etc., also are influential. So there's a lot of association between the microbiota and the diseases like fibromyalgia, IBS, IBD, depression, anxiety, diabetes, rheumatoid arthritis, etc. And there is a very convincing link between diabetes and gut microbiota. And you know, we commonly ask about the diet, what kind of physical activity, whether the person is a smoker or not, whether the person consumes alcohol, what kind of medications they're on, what is the mode of birth, and you know the relevance why. And all of these, it does have a potential sort of an influence on the gut microbiota itself. So gut microbiome balance controls the long-term health. And gut microbiota and host metabolism in transition from the infants to adulthood, the gut microbiota changes and interacts with the host metabolism, leading to metabolic and cardiometabolic diseases. So basically, gut microbiota can act at various levels. So whether it's the adipose tissue influencing fat storage or the skeletal muscles involving in energy metabolism, liver, cardiovascular system like the heart and the blood vessels causing cardiovascular disease, and a host of other organs. I wanted to emphasize that there is a very different kind of microbiota that is seen in the obese individuals and lean individuals. So obese individuals, you can clearly see that the lipopolysaccharide-mediated inflammation is more. The small chain fatty acid lipogenesis is more. Incretin secretion becomes less. Butyric production, again, something which is beneficial, becomes less. And because of all these changes that you see, there is increase in the insulin resistance. However, in the lean gut microbiota, which is healthy, you see that there is more incretin secretion, less small chain fatty acid lipogenesis, etc. And thus, you have more of insulin sensitivity and less of resistance. Now, microbes and host metabolism, and we know that there is a direct link, and I'll be talking to you shortly about this. Now, let's look at the various mechanisms of action that are proposed. So lipopolysaccharide, which is sort of you see in the outer membrane of the gram-negative bacteria, they attach to the toll-like receptors that you see in here, and that signals the pro-inflammatory pathways. When it comes to the short-chain fatty acids, the dietary fibers are converted to this is converted by the gut microbiota into butyrate, acetate, and propionate. And if you look at the G cell coupled receptors, GPR41 and 43, they sort of mediate whether they act on the inflammatory cells or the immune system, causing less of inflammation, or they act on the L cells and increase the endogenous GLP-1 levels and the PYY levels, causing increased incretin action. So all of these are beneficial for
Dr. Sudhir, sorry to interrupt you. You have last 1 minute to end up the session.
Sorry, I thought I have 15 minutes.
Yeah, it's already 4:05. Okay, continue.
Okay, thank you. Okay, so quickly going into the gut microbiota and possible molecular mechanisms which are related to the cardiovascular system. And I can sort of give you in a nutshell that it has got the potential to change the whether it's the increased atherogenesis or increasing the cardiovascular risks or the heart failure potentiation. All these can be related. And we have already talked about the various mechanisms, how it predisposes. So gut connection to diabetes, the concept of eubiosis and dysbiosis was not just a theory now, and it's already established. And we know that the obesity mediated, the microbiota you see in the obese individuals are very, very different from that in the lean individuals. And I'll try and show you some of the studies which will go and tell you what is the relationship. So gut microbiota and role in diabetes mellitus, we had said that the Western diet, the antibiotics, etc., causes dysbiosis and causes decrease in the short-chain fatty acid production, decrease in the GLP-1 secretion, and also increased inflammation. And we had already shown you the mechanism of decreased incretin secretion and PYY. So the mechanisms that are actually mediated are increased in obesity, postprandial spike, etc. I'll skip all of these and come to a few of the randomized control trials, as well as the meta-analysis. 15, if you consider 15 randomized control trials and a meta-analysis done by Wontao with around 902 participants, they concluded that the probiotic treatment may reduce the HbA1c fasting and insulin resistance in type 2 diabetic patients. This is again by Bhattacharyya et al. A meta-analysis of 13 randomized control trials shows that probiotics appear to have a beneficial role in the management of type 2 diabetes. Again, 32 clinical trials meta-analysis conclusively proved that probiotics could be a supplementary therapeutic approach in type 2 diabetes and can improve dyslipidemia and promote better metabolic action. So the whole idea is to combine. So you take multi-species probiotic supplementation, and in doing so, you see this double-blinded placebo-controlled study, which conclusively shows that multi-species probiotic supplementation prevented rise in the fasting, as well as decreases the serum HSCRP levels, which could be cardioprotective. And the final meta-analysis that I wanted to show you was of 16 studies. 12 out of the 16 studies had actually shown that IBS, diarrhea, atopic disease, immune function, all of them got better with the use of the probiotic itself. So yes, there is a convincing link between diabetes and dysbiosis. And the day is not very far when the doctors are going to do a gut profiling and give food plans to the patients and individualize the care. So with this, thank you so much for your kind and patient hearing.